Greetings, class. Here today to discuss positives and negatives of telehealth and virtual healthcare of any kind. Is it a good thing? Why do we think it's a bad idea? So let's just dive right in. So the first question was, can nurses be replaced? And I thought it was interesting that this question was posed because I thought about this concept when we received a teledoc on our floor as the COVID unit from my hospital. And I mentioned this topic in my response to Eric last week in the discussion that, when I saw that teledoc, I thought, well, if this could be done with a physician, well, it could just as easily be done with nurses, right? We could have, couple that with some rumors that I had heard that, some of the area nursing homes were looking at the ideas of training nurse assistants or unlicensed people to pass certain medications to help combat shortages in the nursing homes around our area. And so I thought, well, that's right up teledoc or telenurse's alley, right? That's just something that could easily be looked at. But according to the American Heart Association, AHA.org, I was doing some research and found that there's these nursing robots called Moxie. And cute little guys, got little, they look like little Nintendo robots or something, but they're called Moxie, and they were employed to select hospitals around the country, one of those being Cedars-Sinai in California. And they were involved in some trials to try to figure out if they could be of assistance. And these robots transported prescriptions, equipment, supplies, and any other things that the nurses would otherwise have to retrieve themselves. And according to David Marshall with Cedars-Sinai, he says, these can take up a third of the nurse's time in the healthcare setting. So these two Moxie that they have saved nurses up to 300 miles of walking during their first 6 weeks in use. That's pretty remarkable. And so the positives here, obviously nurses need help. And we need more nurses that we just can't get. We need more nursing assistants. Can't seem to find those either. So if we had some of these Moxies, they run up to 22 hours on a charge. They don't need to take a lunch break. They don't need to take a stress break. They just do what we put in there and what we program them to do. And they have the artificial intelligence to adapt to the changes in the workflows. And they're efficient at the task that's been given to them. Negatives, though, aside from being somewhat frightening to some people and those that aren't quite ready to accept technology into our integrated into human life, this one of the things that artificial intelligence at this time doesn't have. It's close, but it's not quite like human critical thinking skills, right? So they're really just in sort of an assistant type phase rather as to actually being the nurse taking care of the patient. And sometimes patients just need a human connection as part of their healing. But according to the AHA, these nurse robots, each one costs $1.5 million. So cost is definitely an issue there as well. So mass integration of robotics, costly, but it could also cause a huge increase in unemployment as well. But I think there's room for both. Telehealth, in my personal experience, is great. I just recently had strep throat, and I used CAMC telehealth to speak to my physician. I uploaded some pictures of my throat and talked to them on the phone. They agreed that that's what it was strep throat, sent me a prescription for amoxicillin to my pharmacy, and there we go. Positives of virtual care included the quickness of that televisit, low spread of illness in a clinical setting. I could have gone in there and spread strep throat to whoever was in that waiting area, right? And there's fast access to medication. To make the call, see the person, it's there for me to go pick up in 20 minutes. The negatives of telehealth could include amounts of jobs that it could potentially remove, as we discussed earlier, cost of the system in order to run this, plus maintenance involving and upkeep of technological systems. But more than that, it does limit the physical examination, and simply just the fact that it's not possible to do everything remotely, right? It's just not possible. One of the other concerns that one of my references, Miss Watson, talks about is protected information concerns, right? So potential HIPAA violations if a hacker got into some of these systems. And there's also some potential for telehealth services to not be covered by insurance, which could lead to huge out of pocket expenses as well. I think the increase in the discussions around virtual care of any type, they all seem to ramp up during the COVID-19 pandemic. And of course, why wouldn't it? You know, it's been 100 years since humanity experienced living through a pandemic, and advances in technology certainly helped us navigate through it much faster and more efficiently. So even though there was a massive loss of life, that amount could have been far greater, I think, without things like this. And I think that the advantages that we saw with using virtual doctors, 24/7 care apps, you know, the telehealths, etc., they've all continued to carry over into post-pandemic life. And I think that that's very important. It gives us another avenue. So during the pandemic, telehealth became the primary care method for millions, according to Carolyn Rutledge, with the online journal for issues in nursing. And the prioritization of the in-person nurse-patient relationship witnessed a huge shift. And then the healthcare field at times was ill-prepared to pivot from those in-person visits to the telehealth field. So that made the shift more challenging. But now we're here 3 years later, and the doors are wide open to provide care in a far more efficient way without having to crowd EDs or urgent care offices. You know, honestly, what a time to be alive, right? Could you imagine, 20 years ago, us sitting around talking about this? It's pretty remarkable. But the best part is there are no indications that these methods are going away, and they're only getting better, faster, more efficient. This can do nothing but good things for the healthcare system. So that's my take. Talk to you soon. Thank you.